Morning, friends. Today I am here again back with some repertorial rubrics that we usually that usually face during the case taking and while we are talking with the patients. So let us talk on another new rubric that I am going to explain to you, and it is about the sarcasm. Now, I want to share with you what actually sarcasm is. And what are its repertorial usage in the repertory? Why we have these rubrics in our repertory? Now, usually during conversation, while we are talking with the patients, and they talk in a different way. So it is a language. It is a language. Language. Why the language is used? It is a medium of communication. It is reflection of thoughts, emotions, and special introductions. Among the various expressions, there are different ways that people can express it for you. The expressive tool, the language of the sarcasm stand out as a powerful device that blends of the humor. A conversation that includes the humor, irony, criticism, or joking. And it is just making something you want to say something bitter, but you say it in a milder way. Whether in everyday conversations, social media exchange, or political speeches, sarcasm has craved a niche for itself in modern discourses. So let us explain and try to see the purpose and how the patient can appear before you when they are talking to us. So now, friends, this presentation is basically related to our repertorial reference. I'm just going to make a slide. So it is I am so clever that even sometimes I don't understand a single word of what I am saying. This usually patients say. So what they will do? They will simply make a remark. Yeah, you are very good. You are to, that means whether he has understood or not, he is appreciating, and this is the way one of the communicate. Then another is let us what I am going to discuss today: the summary, introductions, understanding what is sarcasm. Sarcasm means homeopathic case taking. Sarcasm as a rubrics in major repertory, and remedies known for sarcasm, the common remedy, and then clinical case examples, role of mental totality, limitation and challenges, suggestions for the practitioner, conclusion, and the references. So, as I told you, it is a complex emotional and communicative expression, often misunderstood and rarely explored in the context of homeopathic case taking and repertorization. And here we are going into the psychology of the sarcasm, its manifestation in patient, how the patient manifests, the interpretative and challenges it poses as representations in the major repertory. It emerges as a significant keynote of underlying traits, aiding to remedy selections when understood constructively. So when the patient is talking to you, and when you can understand the way he is communicating, you can understand. So while you are listening to the patient, you have to be careful that how he expresses himself. This it is a mental rubrics. To put in your mental chapter, it is an integrative understanding of sarcasm will enrich your totality of symptoms and sharpening the clinical sensitivity to the subject. So it is sharp. It is often a sharp, cutting form of speech. Very right. You are talking this type of. You can also correlate this sarcasm as an rude type of the talk, and sometimes the joking type of that talk, where intended meaning in a opposite literally. What you want to say, the word, the speech that is coming out from his mouth is something different. It lies within the broader spectrum of irony used to ridicule, criticize, or express disdain, often less with a wit of humor. है ना, with or humor. In medical setting, particularly in homeopathy, sarcasm may not merely be a social or rhetorical device, but a psychological trait reflecting deeper emotional states. The way patients use sarcasm frequently or habitually, sometimes, or if it is a habit, yes, or sometimes rarely, can unravel suppressed emotions, defense mechanisms, and chronic mental states. So you can learn from the sarcasm. You can learn, you can see if you understand the sarcasm, the way he's talking to you, you can know that what are his suppressed emotions, his defense, what he want to defend himself, and what are his chronic states. In homeopathy, when individualizing the patient's personality, sarcasm helps you to subtle potential, very minute potential mental symptoms. Its careful observation during case taking and interpretation in repertorial language can provide insight into remedy selection. So here we are the clinical expressions, how it is reflected in the psychology, the pathology, and how it has located in the various repertory, including pain, synthesis, complete, and mind-focused repertory. Sarcasm is the body's natural defense against stupidity. This is something unknown. That means it is natural body defense. Just you want to defend yourself, but you defend yourself stupidly. What is the definitions and linguistic context? The term sarcasm is originated from the Greek word sarcasm, meaning to tear flesh, to take out, metamorphically, referring to the speech means to wound or mock, to harm you, to hurt you, or to make a joke of you. Unlike overt aggression, sarcasm is often cloaked in polite or humorous language, making it more insidious. Now, sarcasm involves what there is a speaker, then is literal meaning, message, and contrary intended meaning. The word what he is saying and what are the intended meaning, what he want to say, and inflict critical or mocking tone, the way he talks. Then the psychodynamic roots are a defense mechanism against vulnerability or pain. I'll refer with some of the examples later on. A form of passive aggression. You are trying to say something, but in a very low mood. A reflection of tiny bitterness or emotional delinquency. Then it is frequently seen in suppressed individuals, the persons who are mentally suppressed, who cannot express their anger openly, highly intellectual personality who use sarcasm as a wit. The people who are they don't scold you, but they will make a joke. People with chronic disappointment, especially with those with a pessimistic view, the people who are negative in nature, they will usually talk like this. So common clinical correlations are depression, marked or reactive, dysthymia, borderline personality trait, obsessive or neurotic tendencies, social anxiety, or narcissistic wounds. Observing the patient's speech and behavior. Now, in classical homeopathy, detailed case taking includes not just what the patient says, but how they say it. What the patient say and how they say it. It is two important things that we have to learn. What the patient want to say and how they are going to say. The sarcastic patient will display like cynical humor about their suffering, mocking response when asked about the symptoms, disrespectful remark about other doctor, oh doctor, that I went to that doctor, but he was not so much serious about the problem. Then bitter jokes about life, relationship, or death, passive aggressive interactions with caregivers. Now, some of the examples that I have a patient, 42-year-old patient woman with chronic migraines. Oh, your little sugar pills will magically cure this pounding headache that a real doctor couldn't fix in 10 years. Now, what he's saying, he says that he thought that this a small your homeopathic medicines will cure, and he says it's good. But it was his fault. He had no belief in that. The patients who don't believe, they talk like this. Oh, doctor, you have so many doctors have given me so medicine, and now that this medicine is going to really work. This is the sarcastic remark. So this response is sarcastic. It displays disbelief, mockery, and intellectual superiority traits that helps identify her inner states. Then another, a patient, a teenager with acne saying, great, now I look like I have been attacked by pizza. Huh? Attacked by pizza. At least my face matched my life, full of greedy drama. Now the sarcasm reflects self-depreciation, hopelessness, and desire for attention. So my face is looking like a dog. My face is looking like a pizza. So that's what he said. He is not looking good, but he said he's comparing it. So it is the this is a self-depreciation, hopelessness and desire for attention clogged in humor. Then sarcasm as rubrics and major repertory. Though sarcasm will not always expressly maintain related rubrics in the mind chapter of repertory, entry in the inclusion. State repertory, being concise and philosophical, does not have a specific rubric for sarcasm. But you can have the relevant rubrics like contemptuous, mocking, censorious, critical, jealousy, loquacity, wit attempts to. Each of these rubrics, while not identical, overlap with the sarcastic behavior when observed carefully. Now, in the synthesis repertory, there are some other mind mocking, which means making some joke. The remedies are lachesis, nux vomica, anacardium, Alzheimer's. Mind ironical, sarcastic, and it is remedies are the lachesis, platina, nux vomica. Mind censorious, critical, fault finding, always trying to say something. And remedies are nitric acid, sepia, lycopodium, etc. These rubrics, when used with other general and particular modality, can guide a more nuanced prescriptions. Then a complete repertory, mind sarcastic. The remedies or lachesis and nux vomica, platina are common. Mind mocking, lachesis, rectum, anacardium. Mind humor, sarcastic or cynical, lachesis and nux vomica. So some of the remedies that is known for the sarcasm. Now lachesis, it is dominant, expressive, and often sarcastic. It feels superior and scornful. Uses sarcasm as a tool of assertive dominance. They want to dominate by making a joke, and irritability, jealousy, loquacity with the wits. Platina, it is a haughty peasant with full of the dominator's dictatorial behavior, sarcastic with the feeling superiority, ridicules other. They will always try to make ridicule other. Disdainful in tone, speech loaded with the mockery. Then nux vomica, cynical and sharp tongue. Sarcasm often reflects impatience and dissatisfaction, displays contempt towards the insufficiency or incompetence. Then anacardium, conflict of will. Two wills are there. Cruelty marked by sarcasm, often mocks other to assert inner control. Can alternate between submissiveness and sarcasm. So, two moods. Retrum. Sarcasm accompanied by religious or moral grandiosity. Uses ridicule to belittle others. Mentally active, dramatic, and grandiose in itself. Alzheimer's. Sarcastic with vulgar and inappropriate humor. Jealousy and sexual insinuation, often used in cases with a mental derangement. Some of the example of the again, I am going to give you some of the example of the present example. For sure, the pain only ruins my half day. What a treat! Now, the patient was under your sitting before you, and he has spent so much time. But he said, now the pain will not only ruins my half day is lost. So, what type of the treatment indicates suppressed frustration? Patient may be trivializing their sufferings to cope with the chronic illness. Now, second, right, because everyone dreams of spending their weekend in bed with a migraine. Or people are making some, they pretend, and because that I am suffering from the headache, so I should be impulse resignations mixed with the anger or bitterness. No, I am not worried at all. Just planning my funeral early at that. I'm not worried, but I am planning how I will die. So exaggerated denial, masking real anxiety and fear of anxiety disease. Of course, I am happy. Who wouldn't be with this charming rash all over the body? So many rash are there, and with this I am happy, and it looks good. But what is this is hidden embarrassment or distress from the skin disease. Uh, then yes, doctor, I love taking 12 different pills a day. It is my new hobby. This the patient said, I love taking so many medicines. Why? But he has medications. You don't want to take the multiple medicines. So he's saying like that. Sleep. What's that? Sound like something only healthy people do. Now sleep. What is that? I don't know what is sleep. Reflects irritability, exhaustion, and possibly a depressive undercurrent. I have only been tired for 10 years. Why would I be concerned? 10 years is lost. And I am, so why I should be concerned? It is deflections possibly indicating chronic fatigue and emotional burnout. This is the third time this year I have had these wonderful infections. I must be collecting them. So he was having the frequent attack, and he said, telling you now this the third within this. So I am collecting so many infections, so many bacteria inside my body. So humor masking concern over the recurrent illness and the immunity. Oh, I am absolutely thrilled to be here talking about my bowel movement. Now he's trying to embarrassment questions. So it is a defensive sarcasm often used in response to sensitive or embracing questions. If I get healthier, I will be dead. Now the patient say he want to become healthy, but he say in a negative way, if I become healthier, I will be dead. Dark humor that may point to depression or the hopelessness. So now I'm going to discuss with you some of the case. Case number one, chronic sarcastic humor with digestive disturbance. Female 36 year, recurrent acidity and IBS. She says, my stomach is unreliable as my ex-husband always rumbles but never delivering anything good. Now he's talking and comparing her stomach problem with the ex-husband. So now the rubrics are mind sarcastic, lachesis, naxvomica, mind anger, suppressed staphylococcus nextramute, abdomen pain, burning after eating naxvomica. Remedy prescribed was naxvomica. Patient improved significantly in 3 months. Then case number two, sarcasm and grief. It's a 52 years male whose son has died. Now he responds, oh God, yes, God has a great sense of humor, giving you a child and just snatching him away. He has given a gift to me and now he has taken away. So rubrics are sarcastic, grief, elements from, and mind, religious affections alternating with sarcasm, peritum. The remedy prescribed was lachesis and marked improvement in communications and sleep. So now, role of in mental totality. Sarcasm is often layered symptoms, not always qualifying as a keynote, but valuable in building the patient's personality profile, understanding the defense mechanism, exploring underlying grief, anger, or superiority, identifying remedy states that expresses themselves indirectly. Now, what are the limitations? Uh, cultural differences? In different culture, you may have the different language and different way of talking. You go to the different region of Bihar, Bengal, and any other place. So we have to be careful about the subjectivity. Homeopathy interpretations and sarcasm must be precisely for contextual and grounded. And then repertorial scarcity. There are very few repertory rubrics that is put into the repertory. And over reliance, don't always rely on the speech. Not all sarcastic people show it in during the short consultation. You're talking how much time you are talking with the patient, 1 hour or 15 minutes, 10 minutes, and within that, how you can decide the sarcasm. So you have to be careful when you are using these rubrics. Now, what is the suggestions? My suggestions is that record speech pattern verbatim to revisit tone and so you can see later on. Then correlate sarcasm with the general behavior, not just isolated phrase. Include sarcasm in mental totality, especially when recurrent or habitual. In cross references with the rubrics are wit, contempt, mockery, and fault finding, and use metra medica to differentiate. So sarcastic traits are different for each variability. So conclusion is that sarcasm, though subtle, is a powerful indicator of patient's mental landscape. When accurately interpreted, it enhances the individual process of central homeopathy. The repertorial treatment of sarcasm is limited, but involving remedies like lachesis, Naxovica, and Platina can capture the sarcastic state in their core essence by integrating sarcasm in the totality and recognizing it as more than verbal humor. The homeopathic practitioner depends both understanding and the therapeutic procedure. So thank you. Sarcasm is the lowest form of wit, yet it remains the funniest. So these are the references: Kent Repertory, Swan's Synthesis Repertory, Janduvar's Complete Repertory, then Morrison's Guide to Keynotes, Performative Symptoms, Sankaran, The Spirit of Homeopathy, Clark Dictionary, Vithal Koss, Essence of Homeopathic Medica, and then in the DSM-5, you can get the explanation definitions for it, and Oxford Dictionary, the English etymology. So little things of affect little minds. With these quotations, I am actually not funny. I am just mean. The people think I must be joking. So thank you very much for your patience hearing. And let's with this I conclude this lecture. So thank you, friends. I hope you may be you have enjoyed. If you have any questions, you can respond to me on my WhatsApp 943310622, or you can email me on risdth@gmail.com. I will come back again with another rubric in short time. Thank you very much. With this, I conclude my sessions.